At the Colorado Health Foundation, we have a cornerstone that's really important to all of the work that we do, which is that it starts with listening and being informed by the people of Colorado that we exist to serve. And so we conduct Pulse every year as a form of listening. It's a way for us to have a conversation with a broad range of people from across our state.
So one of the things that really stood out from this year's survey is the increased concern that Coloradans have about mental health. Last year, a 55% majority of Coloradans rated mental health as a extremely or very serious problem in Colorado. And this year that rose 8 points to 63%. We had a majority of Coloradans, 55%, who told us they had felt anxiety in the past year. Sizable numbers also telling us that they had experienced grief or loss, difficulty focusing, a hard time connecting with family and friends, and more than a third who told us they had felt depression over the course of the previous year. We asked the respondents to consider a number of different racial or ethnic subgroups of the state's population and indicate whether they thought those groups were more likely or less likely to be treated fairly when it comes to getting access to high quality healthcare or when it comes to having the opportunity to rent or buy a home. And what the data show is that Coloradans overall, by pluralities or majorities, tell us they think that communities of color are less likely to be treated fairly than are white Coloradans. In addition, we also asked about policing and asked whether Coloradans thought that various communities of color are more likely or less likely to be treated fairly by police. It was interesting to note that these numbers were very consistent between last year's survey, which was conducted in the late summer of 2020, and this year's survey conducted at the same point in 2021. Last year, we obviously over the summer, there was a strong national focus on racial equity in a variety of different ways. And one might have thought that that might have boosted the awareness of some of these issues in Colorado in last year's survey. But we really saw no meaningful change this year. Coloradans just as likely to perceive some of these disparities in fair treatment across lines of race and ethnicity. One of the most interesting things about the poll findings is the degree to which we can see how all of these issues are interconnected. When Coloradans are treated unfairly and denied the opportunity for adequate health care or affordable housing, that can place an economic strain on them. When they feel that economic strain, the data shows they are more likely to report facing mental health challenges. And together, I think those findings help to explain why there is such overwhelming support among Coloradans for more efforts by state government to try to help the public with some of these issues that affect their health in so many different ways. That they'd like there to be efforts to change regulations to try to make healthcare more affordable, and that they'd like to see more support for creating more affordable housing. All of these kinds of investments we can see in the data are things that are going to impact people's financial well-being, but that are also going to ease strains on their mental health. You can learn more and use our interactive dashboard, which allows you to dive deeper into the data, on our website. Visit copulsepoll.org for more information.